Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for Thursday, March the 11th for British Columbia. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees in the Esquimalt First Nations. Today is the first anniversary of the declaration of the pandemic for the World Health Organization. It's a day for us to be solemn because of those that we've lost and those that have lost so much in the pandemic, but also to be very proud of our extraordinary team of healthcare workers and all the people of British Columbia who've responded in a generous, thoughtful, and kind way. And it's now my honor to introduce Dr. Bonnie Henry.
Thank you very much, and indeed this has been a year, and today we're going to walk through a little bit of what that year looked like in terms of the data that we have here in BC. I think to start though, I will just update us on the numbers for today. We've had 569 new cases today, 3 of which were epidemiologically linked, bringing our total to 86,219 people in BC who have been diagnosed with COVID-19. That includes 140 people in the Vancouver Coastal Health Region, 301 people who live in the Fraser Health Region, 41 in the Vancouver Island Health Region, 26 people in Interior Health, 60 people in Northern Health, and a new case in somebody who normally lives outside of Canada. So we now have 4,912 active cases in the province, of whom 244 are in hospital and 68 are in intensive care or ICU. We have over 8,000 now, 900 people under active public health monitoring, and 79,829 people who have recovered or are no longer infectious. And on this day that we remember everything that's happened over this past year, we've had 3 new deaths to report here in British Columbia, bringing our total to 1,397 people who have lost their lives due to COVID-19. And again, we remember, of course, the families who are mourning the loss of their loved ones during this difficult time. We have one outbreak that's been declared over at the Westside Care Residence, and now are down to 9 active outbreaks in long-term care assisted living and independent living, and 8 in acute care. I'm going to now go to our modeling presentation to give you an update of where we are in terms of the pandemic. And what we've talked about is really most of these data will show you a summary of where we have been in this past year. We know that our pandemic started before this date, but it is March 11th. That was the official declaration of a pandemic by the World Health Organization. This first slide tells us about the geographic distribution of our cases in British Columbia by health service delivery area, which is the broader health area. And as you can see, there has been no part of our province that has been spared from dealing with this virus. On the right-hand side, in the shades of gray, is the last 7 days. And we see as well that while we have cases all over the province, some areas are dealing with a more difficult situation than others, particularly in the Fraser South area and now in the Northwest. Breaking that down by smaller local health area, we see again that there is no part of this province that has not been affected in the past year, and some more than others. And this gives us a much more detailed sense of our communities and the community impact in different areas of the province. And this shows what that impact has been in the last 7 days here in BC. And as we can see, there continues to be hotspots in areas of the province, and particularly right now around Prince Rupert, but also an ongoing challenge in areas in the Fraser Valley. This is a summary of our epidemiologic curves and our hospitalizations and deaths over the past year and a bit. starting back in January of 2020. As we can see, our first wave was relatively small in terms of our numbers of cases. We had a high percentage of cases that were hospitalized, and again, this reflects the fact that early on we had limited access to testing. And the higher proportion of people, the more serious cases, were the ones that we detected early. We did have a bit of a reprieve during the spring and summer, which we all remember, of course. But the virus did not go away, and we saw it again resurge as we moved into the fall. We were rumbling along at a fairly low and controlled level, but when we got to the middle of October, we started to see rapidly increasing cases. And as the numbers of people being infected increased and spread exponentially, more people required hospitalizations, and sadly, more people have died. We've now seen that our peak was somewhere in early December. We've come down since then. We had a little bit of an upswing again after holiday season and over Christmas and New Year's season, but we have been on a steady downward trajectory until about the middle of February. Since then, we started to climb up again, slowly and steadily, but we now are at a level that our 7-day rolling average has increased. But if we look at the statistics, what we see is that our hospitalizations has leveled out and come down, and really importantly, the number of people who are dying from COVID-19 has also decreased dramatically. So those curves are starting to separate. This is the same data presented by Health Authority, and this is by surveillance date, so we can see in the dotted line our rolling 7-day average, and it reflects again the fact that the majority of our cases and our concerns continue to be in the Fraser Health region and the Vancouver Coastal Health region, and in both of those areas we know are the most populated areas of the province. But we have seen increases, and we've seen waves go through in every part of the province. When we look at this by what we call episode date, so that is by the date of onset of illness, that gives us a slightly different pattern, because the previous data that we talked about was the day that the lab test was done or the day it was reported. When we look back on when people were infected, we see a little bit more of a clustering and less pronounced peaks. This is to give us a sense of where we're seeing cases being connected to, and most of them still are related to clusters that we're seeing in our community. And we've shared some information about what these look like. Whether it's getting together at a small gathering for a wedding and inadvertently the virus being transmitted to others there, who then take it to their homes and their workplaces, their schools, their childcare centers. We know that this virus can spread underground before we notice sometimes that it is causing an outbreak. And part of that has to do with the age of people who are being affected. Early on in the pandemic, last March and April, we were mostly seeing older people being affected. And that is because we were monitoring in people who are more likely to end up in hospital. As we've progressed through the summer and into the fall, and again in the winter, what we're seeing it is that the transmission of the virus is being driven by two age groups of people primarily, and that is young people, 19 to 39, and also the age group from 40 to 59. So those are the two curves at the top. There are two scenarios where we're seeing transmission now. The most that transmission that we're seeing occurs when people are getting together, and even now in smaller gatherings, whether it's for social events, having a group together for a birthday party in one's home, meeting up with people in indoor environments, we know is the riskiest part. And the other part that we're seeing a lot of transmission events is in workplaces. And many of those workplaces are places where people cannot effectively separate on an ongoing basis, and the risk is higher. And some of those places we know are workplaces that we need to keep things going, like our food processing centers, like retail sorting centers. And we have been focused very much on our COVID safety plans in those settings. And when they're followed and when people are able to follow them consistently, we know they work. The positive news that we see in this is that the high rates that we were seeing in people over age 80 since October, November have now gradually come down, and largely that reflects the important protection that people are receiving in long-term care, assisted living, and as of the last few weeks, independent living, and our seniors and elders in our community. If we look at what the testing tells us over time and the percent positivity overall in BC, we saw high rates of testing early in the fall, and that continued through the winter months as the numbers of cases continued to increase in our communities. But it was not the same around the province. We know that in Fraser Health and Vancouver Coastal, where access to testing was ramped up and was quite available rapidly, we saw increases in transmission that reflected that. We've now come down and are hovering around 7 to 8% in both of those health authorities. Interior Health had several peaks and has now come down again, and we see the same pattern in Vancouver Island. Where we have more challenges are many communities around the north, where testing is not always as easy to access, and where we have had to deploy some of the more rapid testing, and where we have seen connectivity between communities and people moving between communities and inadvertently bringing the virus with them. And that right now is reflected in what we're seeing in places like Prince Rupert. Overall, we continue to follow the impact of the pandemic on people by different age groups to try and understand who is most at risk. And this has remained consistent over the past year. We still are seeing relatively fewer cases than the population in young children, but we see more cases in people between 20 and 60, and an increase in people who require hospital care, ICU care, and sadly, a dramatic increase in people who are severely affected or die from COVID-19 over the age of 70. What is new about this data that we have today is that in the last few months, we've also seen a number of people in their 30s who have died from COVID-19, and that is a tragedy that we now know can be prevented. We've also been following the impact of the pandemic on young people, and particularly the new syndrome, the multi-inflammatory syndrome in children, which has been identified as sometimes occurring after infection with COVID-19. We have had 10 cases confirmed in children in British Columbia among the over 10,000 children between the ages of 8 and 18 who have been affected. 7 required ICU admission, but all, thankfully, have recovered or are in stable condition, and we have had no children die. As we know, the majority of the cases were in the Fraser Health and Vancouver Coastal Health region, and that's where we see the majority of the MISC cases as well. One of the things that helps us understand the impact of a new virus or of a condition on our population is looking at its impact on overall deaths. And the number of deaths, or the mortality rate that we see, is relatively stable in a large population. On average, we have about 7,500 people who die every year in British Columbia, given our demographics and our age group, and that is relatively stable over time. Recently, StatsCan just put out some data around this measure for all of Canada, and it showed that in all of Canada for the year of 2020, so just from January 1st to December 31st of 2020, there was a 5% increase above expected numbers of people who've died in Canada. And that translates to about 14,000 extra deaths in the country. Many of those were related to COVID-19, primarily in Ontario and Quebec. We've also seen that data coming out of the United States shows that with the measures that they've had in place there and the impact of the pandemic, they had a 15% increase in all-cause mortality, in people who died in that country during 2020. And that is the largest increase that they have had since the 1918 influenza pandemic. It is the third leading cause of death in the United States in 2020. When we look at British Columbia over the last 10 years, from 2009 to 2020, what we see is that the measures and the work that we did in British Columbia together to try and protect people from this virus meant that we have had a slight increase in people who've died, in our all-cause mortality in this province. But we have not seen a dramatic increase that has been seen in other parts of the country or in other countries. And we know that there are two things going on in BC right now. We have this COVID-19 pandemic, which has had impacts on some populations, and we have our overdose crises, which also contributes to excess mortality that we have seen in 2020. If we look at this in some more detail, for a virus that was not even known until we didn't have even cases until into February of, or late January of 2020, it now, for the entire year, COVID-19 was the eighth top cause of death in the province. And that may not seem like much, but it is an important marker that it is in the top reasons that people have been affected. And it tells us that this has had a profound effect on our population. The other thing that I will note, though, is number 5 on our all-cause top 15 causes of death in British Columbia is illicit drug toxicity. So again, the impact of the overdose crisis that we have in the province. And on the right is a measure of what we call potential years of life lost. So we know that some things affect younger people more than older people. And what we have seen is if we look at the potential years of life lost from COVID-19, that drops it as a cause of death to 11. What that tells us is what we've just seen, that COVID-19 has had a profound impact on older people in our communities, and the overdose deaths have had a profound effect on younger people in our communities. And the two of these are what we have had to deal with together here in British Columbia. If we compare, as we do periodically, our what has happened here, our pandemic here in British Columbia compared to other provinces in Canada, what we have seen is that we've had a low and steady rate. We have had an increase, as we know, in the fall and winter, but we've not seen some of the dramatic increases and decreases. And this is in the context of our plans and our ability to, as much as we can, keep as many things open as we can safely. And that means particularly schools, having recognized the impact that closing of schools had on families and children and educators in the spring last year. We've made it a priority. We've also made it a priority to open as many of those businesses that keep our communities functioning as we can safely. And that is reflected in the curve that we've had. Again, looking at the people who've died and our death rates in British Columbia compared to other provinces, we have tried and maintained a low and steady rate. And that, thankfully, is dropping off now. If we compare what happened in British Columbia, our pandemic, to some other countries, particularly ones that we know have been quite hard hit, like Italy, like the USA and the UK, we see again that we have quite low rates compared to international comparisons. And the same applies to the death rates that we've seen here, sadly, in British Columbia. Some of the things that we have been following more recently that concern us and we worry will have an impact on our pandemic for the next period of time are the variants of concern. And we have been watching these carefully. This is just a schematic to show you that our surveillance and our testing for these variants has changed as we've developed new tests that are able to be a marker or an indicator of who has one of these more concerning variants that are associated with increased transmissibility of the virus. So it is a change to this. A change to the spike protein that may mean that it's easier for that strain of the virus to bind to our receptors in our nose and throat and therefore transmit more easily. What we had from the beginning was a three-pronged approach, doing some sampling, a random sampling of some of the viruses that were submitted in samples, positive samples from around the province, targeting where we're seeing outbreaks or clusters to see if any of the variants of concern were involved, and then some of the targeted surveillance, for example, for people who have traveled. What we've now moved to is a more standardized surveillance where all of the tests that are done every day that are positive are then put through a screening test, and that's in the green on this example, the screening test to see if they have one of the variants of concern, the N501Y. That is one of the ones that's a marker, and those ones then go on to whole genome sequencing. So right now, it takes about an extra day for the screening test to be done, and then after that, 3 to 5 days for the whole genome sequencing, so we know exactly which variant it is, or if it is a variant at all, because some of these turn out not to be. So when we report on a daily basis the number of variant cases, they're not in addition to the new cases that we report every day or in the 7-day average. What they are is a 2 to 3 day lag for the ones that we had reported a few days ago. And it is now being sped up so that we are able to detect more rapidly when we have a variant case. What we have seen with this surveillance that we've been doing is that we have seen an increase in the numbers of cases that turn out to be transmitted. Are a variant of concern, and the most common one we have is the B117, which has been associated with the UK, and we're seeing it most commonly in the Fraser Health and the Vancouver coastal area, but particularly in Fraser Health. The second most common one is the B1351, which is the variant associated with South Africa, and we've seen small numbers of that, and not as many, certainly not increasing numbers over time. More recently, we did have one cluster with a new variant, the Brazil variant. It's marked as P1 on this. They were all associated with one group cluster in the Vancouver Coastal Health region, and we've not seen additional transmission from that group. So these are things we're watching very carefully. We need to understand what the impact is of these variants. We are following up as public health, making it a priority to understand the case and contact management of people who have these variants, because we have seen what has happened in other parts of the world when they start to take off. Right now, we are still in a very small percentage of our cases that are variants of concern, and what we are seeing is that with the same measures that we have in place to prevent transmission, including supporting close contacts to be able to effectively isolate, doing testing of close contacts to make sure that they aren't infected before they're released from quarantine, those measures are working. We're not seeing rapid takeoff of variant cases like we have seen reported today from Ontario, for example, where about 40% of the cases. We're still under 10%, but we are seeing that these are increasing, which tells us that every transmission in the community where these are moving on to others puts a little bit more risk into the scenarios that we have. So if you're somebody who's with a group of people and most people are only passing it on to one person, we know that if you have this variant, you may pass it on to more people more easily. But I do want to put this in a bit of perspective for us here in British Columbia. We are looking at a whole genome sequencing of the over 12,000 now variants or lineages that we see in British Columbia since the start of this pandemic. And we can see that this virus changes. And changes not as quickly as some other viruses, but it does change over time. And we have many different variants that are circulating here in BC. And if we focus really just on the two variants of concern that we've seen most often, they are still rare compared to other viruses that are circulating in our communities. And we know that the same measures that we need, that we have been doing, are effective against these ones as well. So that is important for us to pay attention to. We can't let these ones take hold. We need to pay attention to those situations where transmission is more common, and that's indoor settings, when we're close together with people, when we're not wearing our masks, when we're talking loudly. Those are the things that we need to continue to avoid so that we don't give this virus a chance to change. Finally, I want to talk a little bit about the light in our tunnel, and that is the vaccine, the fact that we have safe and effective vaccines and are now rolling them out on a population basis in BC. We've had over 300,000 doses being provided, and over 250,000 people have had the protection from a single dose. Though that protection takes time, it takes several weeks, but we know from the information from the vaccine studies, the vaccine effectiveness studies that we started at the very beginning when we had the first vaccine here in December. We made our research team at the BC CDC. It was important for us and continues to be important for us to monitor every single dose and make sure for safety reasons, but also so we can monitor the impact of the virus. And this work has allowed us to understand the protection that we get even in situations like long-term care homes with our most vulnerable of seniors and elders, that we can have excellent protection from a single dose. And that is what has supported us to be able to make that really important decision to extend the interval for second doses so that we can protect more people more quickly and win that race that we are in right now. So this is the data that helped us make those decisions. It shows very clearly that once 2 to 3 weeks have passed, we have a rapid drop-off in risk for people who have been immunized. And it was as high as 89% after 3 weeks. But we know as well that we need to continue to monitor this, and we will continue to ensure that we're watching to make sure the protection is lasting. This is the similar data presented slightly differently. It looks at people who are in long-term care on the right and healthcare workers on the left. And what we can see is within 2 weeks of immunization, we start to see a dramatic change in risk. So those are things that we will continue to monitor as more and more people are protected in the coming weeks. And I want to end off with looking at our models, because these are things that help us understand where we've been and the potential for where we might be in the future, particularly in the next few weeks. The next 2 weeks are what is going to give us a sense of where we are going to be come April. Right now, what we are seeing is a reflection of the activities that we did and the risks that we took or didn't take 2 weeks ago. And what we can see here in BC, that our reproductive number has been hovering along 1, but it's not the same everywhere in the province. And we know that we want it to drop below 1. And when we have concerns, variants of concern that are more transmissible, we need to get it even further below 1. And that is about the risky contacts that we have with others. So infectious contacts. So that's the time when you went with a small group of people and in your workplace and you took your masks off, or you had a coffee break together with others, or you had that other family into your home without taking those precautions. Those are the risky connections. If we do those with maintaining our distance, keeping our numbers small, wearing our masks when we can't maintain our distance, those are protected connections. Those are the connections that we need now. And what we see, of course, is that there's quite a lot of fluctuation with the smaller populations in the interior of Vancouver Island and the north. All of those have started to come back towards 1 and under 1. Where our population is the greatest and where we have the most impact has been in the Fraser Health region and Vancouver Coastal. And once again, we're trending back towards where we want to be, but we're not there yet. And the other models help us understand the risk and the situation that we're in right now. So what we can see is for interior Vancouver Island and the north, we're trending nicely downwards. Where we have concerns, of course, is the potential for what could happen in Fraser Health and in Vancouver Coastal. And we know that's because that's where the higher numbers of cases are, but also the most population. So that is where we need to pay even more attention to making sure that our connections with each other, those needed connections that we have, are done in a safe way. And what this shows for BC is that much of what our future could be is driven by what happens in our populous areas in the lower mainland. And to end up, this is the scenarios that we could be looking at. So this is modeling, so this is not a prediction, but it is helps us understand the things that we need to do. Right now, the models show that we're somewhere around 50 to 60% of our normal infectious contact rates. In the past, when we know we can get it down to 40, 45, 50%, we can bend that curve back down. That's what we need to think about now. How can we do things to get us through this period of time as more and more people are protected from immunization, from these effective vaccines that we have? How can we do things safely now so that we're not having those potential transmission contacts in our communities right now? So to go back to our data then, as I mentioned, we have to date given over 360,000 doses of the COVID-19 vaccine. And that will be continuing as we have more vaccines arriving this week, as more people are eligible, and as we have our parallel track, of course, with the AstraZeneca Serum Institute of India vaccines that have arrived this week. Today's modeling shows us how this pandemic has progressed in our province over the past year. And what we have seen very clearly, that no one is immune. No community is immune to the virus or the impacts that have come with it. And the pandemic is still very much with us. The most effective tools we have had to control the spread of the virus have been our public health actions, combined with all of our individual efforts. We have made the biggest difference by our individual actions that give us collective safety. Things like washing our hands, staying home when we're sick, getting tested, giving others the space to stay safe, staying apart from our friends and family, and not gathering together, especially indoors, following our public health restrictions and orders. Essentially, it is essential, particularly when we're indoors, whether it's workplaces, whether it's visiting a shop, whether it's having in our schools or in our homes. Our COVID safety plans work when we follow them. And we now have another very powerful means to push back on the virus, and that is our safe and effective vaccines. And with each day that more people are immunized, that level of protection for all of us goes up. We are progressing, but we're not yet in a place where any of us can let go of this progress that we've made as much as we may want to. But what we can do is focus on those things that we can do safely. And right now, as the weather gets better, as we know we're heading into the period where the transmissibility will decrease, and we know we need that social connection, right now what we can do is safely move outside for some of those connections. As a result, and looking at where we are, The Provincial Health Officer Order on Gatherings and Events has been amended to allow for outdoor gatherings for up to 10 people. This means your children can have a play date with their friends over the March break, but with their same group of friends. And if they're in school, the group of friends that they're in a cohort with at school. You can meet friends outside and have a coffee, have a chat, have a connection, have a picnic in your park with your grandparents. Should you choose to meet with your family and friends, remember that those safety measures need to continue and need to be top of mind. We don't want to put people at risk right now when we know we have vaccines that will protect us in the very near future. So if you're seeing a grandparent and they've yet to be immunized, then continue to take those measures. Keep your distance, do it outdoors, wear a mask. I'd like to be clear, there are no changes to the current restrictions on indoor gatherings. Those are the things we need to pay most attention to. But there is an opportunity for us to stay together by staying apart when we're outside and to enjoy and take advantage of that. But no dinner parties. Don't ask your favorite restaurant to have a special event for you. Those are the types of situations where we've seen can lead to transmission that will undo all that we have accomplished. The restrictions that we have in bars and restaurants and pubs remain in effect. All of the restrictions that we need and we know work in our retail settings, in all of the businesses that are open, those we need to adhere to more than ever right now. And we must all continue to use our safety plans at work and school. This is slowly turning the dial. It's not flicking the switch. We know there are a couple of things that are happening in the next few weeks, and one of them is March break. And we encourage you to be a family, to go outside, to explore in your neighborhood. Next week as well, we have St. Patrick's Day coming up, and we know that for some people, that is a day where they like to gather together and have parties. And we know that alcohol sales can be a part of people losing inhibitions and perhaps forgetting their COVID safety plans. We have consulted with the food and beverage industry and had a number of conversations, and they as well are committed to keeping our communities safe and making sure that we don't have those temptations that put their staff and their businesses at risk. We all recognize that importance. And in the spirit of that, my existing order for food and liquor service establishments will be amended so that liquor sales for on-site and off-site consumption must cease between 8 p.m. on March 17th until 9 a.m. on March 18th. And there will be some caveats around full meal provision and how restaurants and bars can stay when they must close. And this was very similar to the restrictions that we put in place over New Year's. And that is really to protect our businesses and to protect the people who work in those businesses, as well as make sure that we don't have an explosive increase in cases related to an event. Right now, we need to save those parties for the summer, because that is what we're looking at right now. We get through this next period of time, and we can make sure that more and more people in our communities are protected. By the time we get to this summer, we will be in a different part of our post-pandemic world. Our recipe and our plan for the next few weeks is straightforward. We need to keep using our layers of protection, particularly in those environments where we know this virus spreads and takes advantage. If we can spend time with a maximum of 10 people, the same people, outside, but smaller continues to be better. And if you're going to see others, it has to be outside. We know, and I know where I come from, we have a saying that common suffering builds strong bonds. And I think all of us can relate to that over this past year. I certainly recognize and acknowledge that we've all experienced losses this past year. Some of them are an accumulation of tiny losses of those joys, those things that we had in our lives. And for some people, it's the tragic loss of a loved one, whether from COVID or whether from other things in this uncertain time. This unrelenting uncertainty that we have all been through together takes its toll, and I know that. Now is the time that we need to reach out again. We need to remember each other. We know that this has been hard, and particularly on our seniors and elders. Connect with them by staying apart and keeping them safe. Connect with the young people in your lives. They have had the least influence and the most impact. We see that in economic data, we see that in the school data, we see that in young people having challenges with jobs, having challenges with doing online university. Reach out to the young people in your life. Remember how important it is to hold them close. And I'll just stop there. It's been a challenging year for us all, and now is the time again to remember to redouble our efforts, to remember to be kind to each other, because that is what makes a difference, and that is what will make us safe. Thank you.
Thank you very much, Dr. Henry, and thank you for all of your work over the past year, which represents so many people and so much dedication of a whole team of people in public health. And we, I think, are a grateful province for that contribution. So thank you very much. I wanted to start by acknowledging the 3 people who passed away related to COVID-19 in the last 24 hours. It is as we know, all of us know, an extraordinary and difficult time, and particularly when we're facing a loss of that magnitude. And so we want to acknowledge the passing of those 3 people and the 1,397 people who passed away from COVID-19 since the beginning of the pandemic. We are thinking of them today, particularly on this 1-year anniversary of many people, because they know an individual who's passed away, who has had a significant loss during COVID-19, are affected by this. But all of us, I think, have those people who've suffered this loss in their hearts. I wanted to note a couple of things about vaccines and immunization clinics, and just to bring you up to date on appointments that are booked. That number as of noon today was 49,761 across health authorities. That's 20,984 in Fraser Health, 7,889 in Interior Health, 7,583 in Vancouver Coastal Health, 7,583 in Vancouver Island Health, 9,691 in Vancouver Coastal Health, and 3,614 in the Northern Health Authority. I want to say that those numbers will be updated at the end of each day from now on, so we're not going to be consistently updating those numbers during the day, but at the end of each day so that people can see the progress that's being made. Today, as of noon, 10,598 appointments were booked on Thursday morning, and we expect today, needless to say, to be a record day. As you know, those aged 85 to 89, born in 1936 or before, as of noon, were able to start to book appointments, and they are doing so in significant numbers, and that's an important thing. There are 74,769 people in those categories, and so we are hopeful that all of those people, or as many as possible, can phone and book appointments in the next few days. I wanted to note, and this is more important than all of that, the 22,698 people over the age of 90 so far in phase 1 and phase 2 of our immunization plan have been immunized, have received their vaccine, either their Pfizer or Moderna vaccine. That a further 28,431 people between the ages of 80 and 89 have received their vaccine. This has happened in long-term care homes and assisted living, in independent living homes, and people receiving long-term home support. And obviously it shows the progress that has been made, progress that will be dramatically increased next week as we begin our immunization clinics for the general population across British Columbia. I want to thank again everyone involved in that process for their work. This morning I'll note that we added, and we're adding information, our weekly report on outbreaks in long-term care, assisted living, and independent living, and note that in long-term care this past week, we've had 12 new test positive cases of residents in long-term care. The overwhelming majority of them, I believe 11, are at the Cottonwoods facility in Kelowna, which we spoke about on Monday. But across, we now have only 6 outbreaks in long-term care, and obviously that report is not as significant as it was some time ago, but it is important to note that that is available for everyone on the BC CDC website. As Dr. Henry has said, 366,791 immunizations have taken place in BC, and that is a significant progress, although we have a long way to go. I wanted to just bring you up to date very briefly on 2 programs that have been related to COVID-19, the Surgical Renewal Commitment, which is continuing, of course, since it was relaunched on May 18th. We've completed, health authorities have completed 74,386 surgeries in Fraser Health, 50,469 in Interior Health, 15,446 in Northern Health, 64,829 in Vancouver Coastal Health, and 56,515 in Vancouver Island Health, and 10,930 by the Provincial Health Services Authority. For the week of February 22nd to 28th, health authorities have verified their data, and the total number of surgeries completed was 7,446, and that is 420 more surgeries in the same week last year, 420 more in a time when COVID protocols and the need for safety has put new challenge in front of our healthcare professionals and our healthcare workers, and I want to thank them for this ongoing effort. I was asked for an update on the programs to support senior services in BC. Note that since July 1st, 2020, the province has hired 1,441 FTEs to support visitation and infection control in long-term care. Of that part of the program, that's 91% of the allocation. Further, the 745 FTEs have now accepted job offers in the HCAP program, so we are making progress on our goal over the next few years to hire 7,000 net new healthcare workers. So I wanted to just conclude very simply by saying that this is what we know, that 279,782 British Columbians have received their first dose of vaccine. That's 6.51% of us who have received the shot. We know it takes up to 21 days for that first dose to reach maximum effectiveness. We know that while vaccines are not 100% effective, and we see that, we also know that these vaccines that we've had in British Columbia to deal with COVID-19 are some of the most effective vaccines that have really ever been produced. We know that with vaccines, it's tempting to ease off behaviors and actions that stop the spread, to do what we want and not what we must. But the science and the message are clear. They were clear in the modeling presented by Dr. Henry. We must continue to use the skills we've been taught, especially as we modify our routines in adapting to guidelines and public health orders as they evolve. Until we have developed the community immunity we are hopeful for from the vaccine, our journey is simply not over, not close to over. And our task continues to turn the tide against COVID-19 in our neighborhoods, our communities, and our lives. Let's continue on this effort, and let's reflect on this 1-year anniversary of the World Health Organization's declaration of the pandemic, not just on all that we've lost, the lives lost, and the opportunities lost, and all the things that we do together that have been lost, but also on what it shows about British Columbia, how generous we've been with one another, how much each of us has contributed to this effort, and the difference that it has made for people. I, for one, am extraordinarily grateful to everyone watching and everyone else in our province who has stepped up for the ones they've loved and stepped up for the ones they don't know. Thank you, thank you, thank you. Aujourd'hui, nous annonçons 569 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 219 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19 pour un total de 1 397 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 244 personnes sont actuellement hospitalisées, dont 68 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press *1 to enter the queue. You're limited to one question and one follow-up. I would also ask that you please take your phones off mute. You're not audible until your name is called. First question today is from Keith Baldry, Global News.
Thank you very much, Dr. Henry, and thank you very much for every briefing for the past year. It's been quite extraordinary. I just want to ask, given our frustrating inability to get our daily case numbers down, we've been stuck at that 500 level for some time. What is the rationale for easing restrictions, even slightly, of having gatherings outdoors of up to 10 people? Is it the warmer weather, the disease won't transmit as quite as effectively, psychological? Is it recognition that spring break behavior may change anyway?
It's a little bit of all of those, yes. You know, we know where the riskiest settings are. We know that it is when we're indoors, when we're crowded situations, when we're close to others. And that has been the focus of trying to, the measures that we have in place in many indoor settings. But I also recognize that, you know, the transmissibility decreases. We're hoping that continues through the spring, and that it is important after these months that we have put to trying to prevent the spread, that we need to have that focus on some of the things we can do and can do safely. And outdoors is where we need to focus right now. So being able to have those important connections that we need, but do them in a way that's not going to put people at risk, and the people that we are closest to, the people that we love, at risk. And we need those opportunities, particularly for young people over this coming March break. So find ways to go explore in your neighborhood. Find ways to go to a park with some friends, to connect in ways that aren't going to make things difficult, but then focus again when you're back indoors on the things that we know will prevent the spread. So wearing masks, making sure you're not going if you're sick, making sure that that you do keep your group small. Go with your family or your household to the restaurant. Keep those distances. Make sure you're not putting others at risk, because part of what we do around the orders is try and have as few as possible, but also making sure that we're not overwhelming our public health system. And we have and still have concerns about the variants, but we're watching them and we're controlling them. And we can safely go outside as long as we're taking those extra precautions in the other parts of our life. And we have the public health resources to do the case management, making sure people can effectively isolate, and we can support you to do that, and the contact tracing and contact follow-up that we need to do. So that's what we're focusing on, recognizing that we're in this tenuous place right now and that we need to get through until April. And if we can do that, and we can do that safely with each other over the next few weeks, so what we do now is going to affect what happens in the next few weeks, then we can look at what we can do in April as well. So yes, it is a little bit of all of that. We need this now, but we need to do it in a way and focus on the things that are safe for us to do outside.
Follow-up, Keith?
Yes, there's an outbreak at the Cottonwood Care Centre in the Okanagan, and there's been conflicting media reports that suggest either a significant portion of the staff have either declined to get vaccinated or haven't been able to access the vaccine. Just wondering if you or Ministry could have any update or information on what the situation is there.
Yeah, so I know Interior Health is looking at that very carefully, and yes, there was most of the residents were vaccinated, but we also know there's turnover in long-term care homes. People come in, people come out for different reasons, and they are offering again immunization, and there were a certain percentage of the staff, we understand, who weren't available or didn't receive it in the first couple of times they went through, but that is of course paying attention to that, and to all long-term care home staff. Many people, and we understand this, long-term care home staff were people who were first in line for vaccine, and many had concerns. They had legitimate questions about these new vaccines, and we are now addressing them. We now have more confidence. We now know that many more of us have had the vaccine and that it is safe. And whereas there are many questions that are circulating that we're addressing every day. So I think I know Interior Health is working with the community and with the care home to make sure that everybody has the opportunity to be immunized now, and that we get those rates up to where we need them to be to protect people.
Next question is from Lisa Eusta, News 1130.
Hi, I wonder about the variants that you've shown us this list of the full picture of variants, but people were getting lists of what variants were in schools and what schools were affected. I'm wondering why that isn't happening anymore and will that happen again?
Yeah, so what we have found is that most of the exposure events that we're seeing in schools, all of the exposure events we're seeing in schools reflect what's going on in the community, and so most of them are not exposures with the variants. When we first saw this, we needed to pay attention and understand whether we were going to see increased transmission from those variants in a school setting. That was really important for us to understand, and we've done quite a lot of testing around all of the exposure events that we've known so far, and we're not seeing that rapidly exploding outbreaks that we've seen people describe in other places, which is reassuring. It's not perfect, and nothing that we do is, but we are learning about it. And we're now learning that these variants are not causing a difference from the other strains that we're seeing. And as we can see, they're a small percentage of what we're seeing. So we are continuing to report exposure events, and it's become apparent to us that we don't need to do things differently just because it's a variant or not. The other thing that I think is important is that the schools that have been most affected have been in the Fraser Health region. That's where we've seen most of the variant cases, but that's also where we're seeing most of our cases of the virus spreading in the community right now. So that is important for us to know. Those are the places we need to pay meticulous attention to adhering to our safety plans. And we'll continue to report exposure events, clusters, and outbreaks as we have been in the school system going forward. And it was, I understand as well, part of it is it was confusing to people because the variants take some days to determine, and it doesn't affect our management and our the activities that are taken with the school community when exposure happens.
Lisa, do you have a follow-up?
Yes. When you're talking about these gatherings of 10 people, spring break coming up, can you be a little more prescriptive, if possible, about what parents can do, what they can do? People are going to want to do sleepovers. They're going to want to have other kinds of gatherings. I'm wondering if you can be a little prescriptive about what people can and can't do over these next few weeks, because people are going to be jacked up about getting together with their friends.
Yeah, and absolutely. And let's be clear, sleepovers indoors are an ixnay right now. We know that this is transmitted when we have even small social gatherings, and we've seen that. We've seen birthday parties with less than 10 people where somebody inadvertently spreads it to their friends. So that is the things that we have to find ways to have those connections, especially for children, for young people, over the next couple of weeks that are outside. And so that's a maximum of 10. That was a number that we've talked with. There's nothing scientific about it except that it's small enough. You need to know who that is, and it's kind of 2 families worth for the most part. So yes, go out and play a game in the park. Go out and have a picnic, have a barbecue in your backyard, but keep your distance, like we used to do last summer, where we could have those events where we're not getting close enough to each other, and don't have an indoor component to it, because that's when we know it can spread much more quickly. So let's find some opportunities to have games outside, to get together and kick a soccer ball around with some of your friends in the park. Those are the types of things that we can do now safely, but But remember, if we're not feeling well, stay home. If don't avoid it. Put those parties that are indoors that we want to have, the sleepovers and the indoor play dates, until the summer. We'll get there. Right now, though, we want to have smaller groups, spend some time outdoors, go have a coffee and sit on a bench with a friend that you haven't seen in a while. Those are the types of connections that we can make right now and do it safely. And if you have concerns, if the person you're going to meet is somebody who's at risk and hasn't been immunized and protected yet, then wear a mask. Or sit and make sure you keep your distance so that you can do it safely. We know that outdoors is safer than indoors. So those are some of the things to think about now.
Next question is from Shannon Waters, BC Today.
Hi there. I'm hoping, Dr. Henry, that you might be able to provide a little more context on people who are dealing with long-lasting symptoms due to COVID. In the briefing, you talked about, people who are being impacted by this disease around sort of mortality and morbidity. But talking to the BC CDC, it sounds like they don't really have a good handle yet on how many people are being impacted either by long-lasting symptoms due to a COVID infection or by other health impacts due to the disease.
Yeah, so, those things are, the clinical data is something that is challenging. There's no single place that we have the information on everybody who's been infected. But we do have a number of clinics in communities, particularly in the Lower Mainland, where the majority of cases have been, and they are collecting that ongoing information and working with, in the study scenario, being able to understand what sort of things work to help people get through those long symptoms that people are experiencing. But yes, that's not something that we have ready available information on an ongoing for everybody that's been affected. We do have a number of programs that are set up to support people, and I know there's several hundred people that are involved in those. And we are looking at the literature from around the world to help us understand, what are the common symptoms. The things that we do know are that people who have more severe symptoms early on are more likely to have lasting symptoms, but we're learning as we go about that as well. We don't know how long it lasts for some people. We know that it's months now for many people, but we've only known about this virus for a little over a year. So some of that is still trying to be understood, both here in BC, across Canada, and with study groups around the world.
Follow up, Shannon?
Yeah, so information and research coming out of other jurisdictions suggests that approximately 10% of people who are infected with COVID will have these long-lasting symptoms. Other estimates indicate that for people whose illness is severe enough to require hospitalization, that number could be as high as 30%. Given the way BC cases are going these days, that would be upwards of 50 people a day developing long-lasting symptoms. In your daily briefings, you generally mention how many people are considered recovered. The health minister has suggested that you're also providing information on people experiencing long-lasting symptoms. I haven't been able to find that information, but I'm wondering, at this point, do you agree with do you think BC is seeing similar numbers to what is coming out of other jurisdictions? And do you have a plan at this point to start providing this information, given we've now been in the pandemic for a year?
Yeah, so as I said, that's not the information that we actually, individual clinical histories are not something that I have access to on an ongoing basis. And the clinicians who are caring for people, for the individuals who are going through this, whether it's in hospital, the ICU, and their family physicians, and now the series of clinics that we've set up, those are the people that are collecting that information to help us understand for the population here, and they're connecting with the same types of study groups that are happening around the world where we're trying to get a better understanding. We don't yet have a standard definition of what we're talking about. So when we look at some of the studies, and I read these as well to try and understand, they are looking sometimes at different people. We know that anybody who is in the ICU, there's a period of time of recovery that can last a long time, no matter what the cause was of them being in the ICU. So it's unclear yet if it is direct directly related to COVID or if it's related to the trauma that happens when you're in a life-threatening condition that requires you to have intubation or to be in the intensive care unit. So these are all phenomena that are being addressed by the clinicians, and we will be part of all of those studies both here in BC and across the country to put together that picture over time. So I don't have that data. It's not like we're not sharing it. It's we don't know. We don't have any means of following up on every individual person's recovery over time. So those are the things that, yes, it's part of an ongoing research and study, as well as providing clinics where people can get the support that they need.
Next question is from Katie DeRosa, Vancouver Sun.
I'm wondering if you can talk about this investigation going on in the European Union related to the AstraZeneca vaccine and a small number of blood clots. Does that concern you, or will you be looking for advice from NACI? What will BCC doing considering the immunization committee is considering how to deploy this vaccine to frontline workers?
Right. Yes, and absolutely. We've been following that very closely, particularly Denmark and Finland were the two areas of concern, and Switzerland had some issues as well. So this is part of what we do, the adverse events following immunization. It's understanding what happens in every single individual in the period of time after they receive their immunization. And it's part of the information that we provide as well. It's on through the BC CDC. We have a system that does that. We have not seen any of those types of issues here in BC, although we've only just started using the AstraZeneca vaccine. I will also say that we look at everything by lot number, and that was what was the issue in Denmark in particular, and also in Switzerland. It was a particular lot number where they had very small numbers of events. So it was 2 people and 3 people, from what I understand. We were on a call this morning with the regulator, Health Canada, and with our special advisory committee and our Health Canada. Our regulator is sharing information with the regulators from EMEA, from European Union, to understand this. We see this frequently with new products, new vaccines, that if there's a safety signal that comes up that's related to a specific lot number, we put a hold on that until those can be investigated. But what we understand is there's several different types of events that happen. So a blood clot in the lungs, a blood clot in the legs, a heart attack. And the investigators look at each individual one and make a determination of whether it's related to the vaccine or not. We also look at, where else has the vaccine been used, and there's been millions of doses, tens of millions of doses now being used in the UK, for example, and these same safety signals have not happened there. So yes, we are watching this very carefully. It is something that is not unexpected when a new product, a new vaccine is used in large numbers of people. We do not have any of the lot numbers that were concerned in those countries, and the product that we have in British Columbia is from the Serum Institute of India right now, and there are no safety signals associated with the product we have here. But we will, of course, continue to monitor that very closely.
Follow up, Katie?
Yes, please. Ontario and Alberta have rolled out the AstraZeneca vaccine being delivered in pharmacies. Is that something that that BC is considering as it rolls out this dose to the general public?
Yes, absolutely. We have been partners in immunization with pharmacists since 2009, actually, with the influenza pandemic. And we are looking at, especially now that AstraZeneca and hopefully when we get the Johnson & Johnson, the Janssen vaccine. These are fridge-stable vaccines, so that means we can use them in much more targeted and tailored ways, and we don't need special equipment. Having said that, right now, with the limited amount that we got in this week, we have made the decision here in BC to target the areas where we are confident it can make the most difference in protecting our communities, and that is around workplaces where we're seeing clusters and outbreaks and high-risk workplaces. I mentioned earlier that that we have that we have a team that's been working on trying to understand what measures need to be in place in workplaces that lead to outbreaks, and some of them that where we've seen large outbreaks are in places like food processing, where people have to work quite closely together, where wearing PPE can be awkward and it can get messed up with the types of activities you're doing, where barriers are not easy, and also where people may not have the agency to not go into work when they're feeling ill because they need to work to support their families. They may live in group accommodation settings in some places, or multi-generational large family homes. So these are the places where we know outbreaks right now are spilling over into our community and causing clusters and outbreaks in other settings in the community and in homes and families. So we are targeting the initial doses that we have to those settings, and pharmacists are partnering with us in some places. It is we've created a list of criteria with the medical health officers around the province. The 3 areas we're focusing on are the food processing industry, because we know that those are high-risk industries. We're looking at some of the large industrial camps where we have people by necessity traveling in and out to different parts of BC and back and forth into the camps. They live in congregate accommodations, and we know that there's been outbreaks that have spilled over into our communities in BC. And also some of the farm operations and nurseries where we also have workers who are living in crowded accommodations, including our temporary farm workers. So that's our focus right now, and we'll be using a number of different means to immunize people in those settings, and we are confident that that will help us protect our communities as well as those workplaces and the people in the workers in those workplaces at the same time. So that's our strategy for the first part, and then we'll be looking at, as we are expecting more of the vaccine in April, we'll be looking at how do we roll it out from there, and that's what the committee is providing advice to us on in the coming days.
Tom Zatarik, Surrey Now leader.
Hi, Dr. Henry. Will you be permitting the annual Vaisakhi parade in Surrey to go ahead this year?
Yeah, that's a modified version perhaps, but the short answer is it's a bit too early right now. I think we have been, and I have been in discussions with faith leaders and community leaders in this last week and in the last couple of weeks about how we have a number of important celebrations coming up. And how can we, given where we are right now and the situation we have with this pandemic, how can we have safe remembrances or celebrations of these important events? So the parade, probably not, or maybe in a very limited way outside, but I know community leaders are looking at that. But how can we have celebrations? And we've seen some great examples of that with Chinese New Year's, with some of the celebrations that we've had safely in the last few months. And I expect that will be the same for Vaisakhi as well.
Tom, do you have a follow-up?
Yes, just given the magnitude of this event, I mean, we've got 500,000 people congregating on a city street. Do you see even this parade being able to go ahead as it has in years past, even next year?
Okay, for this year, that's a no. For next year, we're going to be in a different world, so who knows? Yeah, the way it was in the past, that's not going to, it cannot happen this year because that just puts too many people at risk.
We have time for one more question this afternoon. For everyone listening, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Tanya Fletcher, CBC.
Dr. Henry, can you specify what the direction is for travel right now, especially over spring break? Last briefing, you'd suggested loosening inter-provincial travel soon. So when can households travel around BC again?
I'm not sure I suggested loosening of anything, but it remains the same. What we need to do is stay local, explore your local community, explore your region. I do think over March break, if you are a family and you're going to your cabin and you're self-contained, that's okay. But we really need to stick to our household, stick to our limited travel, and we need to be very aware. And we looked at the local health area data that's published on the BC CDC website. There are areas where we have a lot of transmission happening, and we do not want people to travel from those areas to an area of low risk. And we don't want people to visit an area that is high risk right now, because those communities are trying to manage the outbreak in their community right now. And it puts you at risk, and then you bring that home with you. So we need to be very mindful of that. So focusing on essential travel if you need to go, focusing on staying with your family, your household, exploring your neighborhood, doing day trips. There are many things that we can do in day trips, and don't go from areas of high risk to low risk.
Tanya, do you have a follow-up?
Revisiting a question you were asked earlier, this morning on CBC's Morning Show in Kelowna, Dr. Carol Fenton from Interior Health said that 35% of staff at the Cottonwoods Care Home, which is the site of a current outbreak, refused to be vaccinated. So it doesn't sound like turnover is the issue according to that. So what message do you have to care home workers who refuse vaccination and members of the public who are asking us whether the vaccination of healthcare workers should be mandatory? And an answer in French as well, please. Thanks.
Yeah. I think maybe refused was an unfortunate use of the term. We know there are many reasons why healthcare workers may not have been immunized. And as I mentioned early on, people had a lot of questions, and that's very legitimate. And we have done our best to try and answer those questions and increase confidence in these vaccines. They are safe, they work, but people, we were talking last night on CBC, they have questions. They have questions about, does it affect me if I'm thinking of getting pregnant? Does it affect me if I'm breastfeeding? Does it affect me if, does it have effects on my future fertility? These were all questions that were a lot more top of mind for people early on when we started these immunization programs. And as we're learning because we now have tens of millions of doses around the world that have been put into people. We understand the reactions to them. We understand some of the medium term, and we get more information about longer term impacts. So the initial advice that came out was if you're pregnant or breastfeeding, to not get the vaccine. We now know that it is safe. We've got more information on people who received the vaccination when they were pregnant, when they were breastfeeding, and we've not seen any safety signals. We have more information on how the vaccines work, and we are confident that they don't have long-term effects on people's fertility. We know that that people are necessarily very concerned and very cautious about taking anything if they're pregnant. We now know as well from work that was done here, talking about clinical follow-up of people, Dr. Deb Money has been leading a study across the country looking at the effects of COVID-19 on pregnancy and on the babies, and we know that there is an increased risk for people who are pregnant to have more severe COVID disease, and it can have effects on their pregnancies. So with that, it's a different risk-benefit balance that we now know tips in the favor of receiving the vaccine. So with more information, we are encouraging more people to be immunized, that it can protect you safely if you're pregnant or if you're thinking of being pregnant, that breastfeeding should not be a deterrent to being immunized. And so those are things that evolve over time as we're learning more about these vaccines. And so I encourage all healthcare workers. It is important for all of us, for our own protection, but also for the protection of our communities and our families, and to show that example of the support for the vaccinations, the safe and effective vaccines that we have. None of our vaccine programs in Canada or in BC are mandatory, and I don't believe this one needs to be either. We know it's an important protection measure for us as individuals, as healthcare workers. But the other thing with this vaccines which I get excited.
Dr. Bonnie Henry answering the last question of today's press conference, at times very emotional. She and Health Minister Adrian Dix providing more information today on this, the 1-year anniversary of the WHO's declaration of a worldwide pandemic. Keith Baldry joins us now with more. Keith, first to the news that was announced today about allowing slightly larger outdoor gatherings ahead of March break, and about liquor sales on St. Patrick's Day.
Yeah, so the emphasis on the word outdoor, not indoor. So restrictions relaxed a little bit. You can now socialize with people in an outdoor setting, up to 10 people, and the same 10 people, don't keep switching groups, similar to what we were a few months ago. The other one, similar to what happened on New Year's Eve, this one being done with much greater notice, of course. So alcohol sales of all kinds banned from 8 p.m. on St. Patrick's Day, that's March 17th, until 9 a.m. the following day, similar as we saw on New Year's Eve. So two public health orders affected today. And again, on the eve of spring break, I think the relaxation, you heard my question to her, how do we sort of square our 500 cases a day? We just can't get below that with this opening up very slightly because it's outdoors, the weather's better. Again, still trying to employ those health protocols, keep your social distance. But there's a psychological aspect to this as well, that people really need some literally room to breathe right now as the weather improves. And the outdoor setting, of course, far preferable than an indoor one. So the rule's still in place for indoors.
Absolutely. Now, we also heard more about where most of our exposures are happening, and this has helped decide where the AstraZeneca vaccine will be used first. Tell us more about that.
Yeah, a lot of work sites are the source of the most transmissions. Again, so you've got food processing plants, some farms in the Fraser Valley, industrial work camps where a lot of people live in very crowded living conditions, similar to long-term care or even correctional facilities where people are congregated in great numbers. Homeless camps, for example, where the virus can spread quite quickly. So that's where AstraZeneca is going to be pinpointed for use, as well as individual clusters of, we see work sites where people can't social distance that go beyond food processing. That's where AstraZeneca will go. Again, this is the initial stage. Once we get into April, when we get a lot more AstraZeneca, because right now we're just talking about that 65,000 doses that have arrived. The next batch is about 130,000, I think, in April. That will be, or 160,000. That'll be even more widely distributed amongst a much broader segment of society. And that's where those, you heard her talk about that committee that's trying to figure out who the essential service workers are across our society in terms of broad groupings and very broadly defined. People from outside of acute healthcare, teachers, truck drivers, again, a number of food production workers and such. That's where AstraZeneca will be going as well, but that's probably not till April.
Now, Keith, several countries in Europe have paused their use of the AstraZeneca vaccine following several reports of adverse effects, notably blood clotting. Should we be concerned?
Well, as I'm not a scientist myself, but Dr. Henry says there are experts, a team of experts that review these vaccines and their health outcomes. And she says there literally, history shows there can be a bad lot of a vaccine. And you heard her talk about that's isolated. If they have any adverse reaction associated with the lot, that lot's taken out of the supply chain. Again, these have been isolated examples. Europe's chief medical officer, though, regulator, has said that he still thinks the benefits of AstraZeneca greatly outweigh any of the risks. Well, that is good news. Keith, thank you. We will have more coming up on Global News at 5, the News Hour at 6.